for these activities. That was one of a creditable system in our Kerala. Our panchayats are more strong, and because of that only, all the developments, especially in health, education, agriculture, all this, because all these institutions are transferred institutions of these local bodies. So in the decentralized planning, transferred institutions are playing a very good model and a very good innovative activities in their based on their local needs. So we will move to the Aardhrakeralam Puraskaram. This is one of the best accolade to the best performing local self-governments in the health sector of Kerala.
Sheena, we are not able to see your PPT. Are you sharing the PPT? Sheena, are you able to hear me?
Yes, sir. It's not shown to you.
No, it is being shown, but it is not moving. Have you shared it in the screen share mode?
Yes.
Okay, but it is not moving here. It is only the first slide that we are seeing.
Just a minute, sir. I'll just cross check once more. Now it's okay.
Yeah, it's moving now. You can start again.
So this is our Chief Minister of Kerala. He had said a very good words about our Aardhrakeralam Puraskaram in the last Aardhrakeralam Puraskaram award ceremony also. It was done in 2023 April. This is our last Aardhrakeralam Puraskaram award ceremony done by our Chief Minister of Kerala in April 2023. And as we mentioned earlier, our decentralized planning in Kerala is into a three-tier system, that is district panchayat, block panchayat, gram panchayat, municipalities and corporation. We have around in 14 districts in Kerala, and we have 14 district panchayats here. We have 152 block panchayats and 972 gram panchayat, 60 municipalities and 6 corporations. And our local sub-governments are situated in a three-tier mode, and our activities are going at grassroots level through this decentralized planning system. In our health system, as I mentioned, institutions are transferred institutions, not only health institution, our education institutions, our agriculture offices, or all these institutions are transferred institution to the local self-government. And in Kerala, as you all know, that the health awareness in the community is very, very high, and people will more focus on their health needs, and they will more focus on specialized care in higher level hospitals for specialized services. In community, in Kerala, the community-based organizations plays a very good role in the healthcare services of health system. In this, NGOs and community-based organizations plays a very good role. In this, we can see in the palliative care and old age care activities, this community organizations are playing a very good role. In Kerala, we have around 450 community-based organizations supporting government for implementing palliative and geriatric care activities in the community. And of course, we have a very powerful hospital management committees with all the intersectoral representation from politicians, NGOs, and all other systems, and community members are also the members of the this hospital management committee. That is in RKS, Rogi Kalyan Samiti. When coming to the comprehensive health plan, in Kerala, when the People's Campaign movement started, it is continuation of that activity. We have started the comprehensive health plan when NHM started in 2006, 2008-9 onwards. We have our comprehensive health plan activities. We have, as everyone knows, that in every year we have our health status report presentation, health status report by local self-government along with the healthcare institutions. And for the preparation of this health status report, in every year, they'll have their health sabhas in every ward for identifying and prioritizing their health issues, health needs based on their local needs. And this is purely based on the SDG goals, because all our Panchayat members and our health officials are purely trained on these lines. And based on these health issues, the project formation and implementations are happening in the local bodies. And in this, the involvement of communities plays a very major role, because in our health status report, when this Ram Sabhas and Health Sabhas is happening, all the community peoples are participating, all the local people are participating, and their involvement and their support is a very good strength for the implementation of these projects and activities. For this technical support, the health system plays a very major role for the LSGD, because the medical officer, the concerned medical officer and health inspectors in the health system are the support system for this team. And with the support of this health institutions, we have a very good training plan for training plan in the comprehensive health plan at that time. And it was carried out with the help of Kerala Institute of Local Administration. At that time, it was Kila was in one district only, but now we have 14 districts. Kila have a support units in all 14 districts, and all our trainings with the support of Kila we are doing for the elected representatives and health officials. And with this, after this, when this comprehensive health plan is going on, in 2011, 12 or 12, 13, we have around 200 crores earmarked by the local bodies for the health outlay. But when it was in 2021, we can see that it was around 1,100 crores earmarked by the total local bodies for the health activities in Kerala. It was mainly focused on the NCD control. Of course, the lifestyle diseases are more in Kerala. Our communicable reemergences of the communicable diseases are very high. Our palliative care services, I don't know, the thing is, our palliative care system is a very good system in Kerala. In all the local bodies, we have a trained palliative nurse supported by palliative care, supported by the local self-government, and these funds are purely from the local self-government. All the technical support is given by the health system. And other projects mainly focused on infrastructure modification, maintenance, maintaining of construction of new labs, medicine purchase, and all this will come under these projects. When the comprehensive health plan is moving, Government of Kerala initiated Aardram Mission activities in 2015-16. And our major objective of our mission, it's a major objective of this mission was the standardization of our healthcare facilities in public health sector. That means we have a minimum standard for all the healthcare institutions of PSC, sub-centers, PSCs, family health centers, taluka hospitals, and district hospitals. Based on this standardization, we have providing HR, all the other things are based on this standardization. And it was another main objective was to reduce the out-of-pocket expenditure, because when the sub-centers and family health centers was initiated, people can directly access all the healthcare facilities their own reach area. They don't have to travel much distant places. And all facilities, we can see that lab facilities are there in the hospital FSCs, insulins are providing the different clinics like palliative clinic, physiotherapy, then all these facilities are available in the FSC itself. So that out-of-pocket expenditure is also reducing is one of the another objective of this mission. Ensure comprehensive primary care. There is preventive, curative, promotive and rehabilitative services and achieve sustainable development goals. That was the main objective of the mission. And for that, these are the main strategies we have adopted for the Aardram program. People-friendly transformation of OP services and hospitals, transforming primary health care into family health centers. We have around, our target was to 800 family health centers. Now it's around 658 family health centers transformed as PSCs as family health centers. And the standardization of Taluka hospital with the specialty services, and the standardization of district hospital with the super specialty services. Our in most of the taluk and the district hospitals, we have dialysis units in Kerala, and ensuring protocol-based, guideline-based management in all the healthcare institutions, and access to healthcare to the marginalized community, especially transgenders, migrant link workers, and with the help of NHM only, we have a lot of activities addressing these strategies. Coming to the Aardhrakeralam Puraskaram, for these are the mission strategies, and we are implementing this, and we have our 638 family health centers as, primary health centers as family health centers. From there, in 2012-13, we have started our Aardhrakeralam Puraskaram, and it was Aardhrakeralam Puraskaram started with the main objective of supporting encouraging our local bodies to do more and quality care services and quality management in the services they are providing to the community. That was the major objective of our Puraskaram. And now we have completed 7th round of Puraskarams in the last April, and this is, as I mentioned, this is a recognition given to the achievements of the local bodies for the their best achievements and best their excellence in primary health activities. And we are incentivizing these local bodies for their quality management in health sector. And this was this Puraskaram was initiated with the support of government only. And in every year we have a government order for initiating the Puraskaram activities in the starting of June itself. And this year also we are moving for that government order. And for moving forward to the grounds of valuation, their outstanding performance we are calculating. This outstanding performance is calculated based on these indicators. These grounds we have going through this. First, we can say is that I'm not mentioning all the grounds. We are mentioning only very few things are added here. We will share our documents regarding the Puraskaram and all for your references and all. And further, any queries and will be added. And regarding these criteria, infrastructural advancement and maintenance of public health institution. That means that we are a lot of infrastructure funds are giving, maintaining the existing institutions are new, revised one, building quality services, accreditations, different accreditations are calculated, Kayakalp awards, cash award, NQS accreditations, and we are assessing the bio-waste management system, sanitation facilities in the local bodies. All this will be assessed. And another thing is project percentage set apart from the health sector and its effective utilization. When the local body and the planning board is issuing the funds to the local self-government, in every year there will be a certain percentage for health, certain percentage for education, and certain percentage for infrastructure, and also that project percentage also will be a calculation for the award criteria. Then percentage of fund allotment for hospital management and infrastructure. That is one of the another important thing. How these local bodies are allocating funds. How was their priority for this healthcare facilities, and how they are, because in all the health institutions they have medicine facilities. Along with that, special things may be added for special medicines for their local needs. Then medical equipments along with that. Then appointment of staff for special services, just like physiotherapists in some family health centers. We can see as physiotherapy units. I think in Wayanad, I think last month, Aman sir visited Nulpura. Can see a very established gym facility. It's not only in Wayanad district, a lot of family health centers we have gym facilities. So all these are come under this, and we all take into consideration for all this. Then formulation and implementation of health plans for public health institution. How this, because in Kerala we have a lot of outbreaks are happening. How these outbreaks are planned. How this indicator based, how they maintaining the indicator based health outcomes like infant mortality, maternal mortality, and how the special projects are maintained, that managed, and that all will be taken into consideration. Then LSGI's involvement in local health needs and ensuring local support. We have a lot of family health centers with getting a lot of funds from the public-private partnership models in Kerala, and that all they are utilizing for the well-being of the community itself. Then solid waste management plans. That's a very important thing in Kerala. How the cleanliness, how the local bodies environment should be clean, how the mosquito control activities are planned, waste collection, segregation, recycling. Because in Kerala, in most of the LSGs, with the support of Harida Karma Sena, we have a very good system for waste collection, management, segregation, incineration, and disposal. So that is one of the another criteria. And as I mentioned earlier, pain and palliative care programs in Kerala, because in the 2011-12 onwards, government issued an order that pain and palliative care is one of the must project for the approval of the local bodies fund for that year. So in Kerala, pain and palliative care programs are 100% implemented in all the local self-governments, in Panchayat, municipality, corporation, at all levels. Then LSJ's health plan and sanitation plan. That is how the water pollution they are conducting, hygienic and hygienic water facilities they are providing. Then how was the public toilet system in the area, water treatment plans, how they are managing the water system in their area, biogas plants, maintain the market area, fish vending areas, then cremations, slaughterhouses. All this will be a part of sanitation activities, and all this will be reviewed. And our geriatric friendly plans, because we have local bodies have special care homes, pagal veedu, daycare centers, so that all will be considered. And epidemic control program and immunization activities. So we have a government have a very good campaign for monsoon preparedness, because we call it Arogya Jagrata, and how local bodies are take up that, and what are the other contributions for achieving the components of SDG goal. These are the major things involved, and along with that we can add involvement of improving conditions of mentally and disabled children and special kids, how local bodies ensuring that. then how is the hospital management committees functioning, how meetings are conducting, how the fund is utilized, for what purpose they are utilizing the fund, the RKS, and fund utilization of WH census. This is another important thing we are screening for the Puraskaram. That is how much money they are getting, and how they are utilizing the water health sanitation fund, and how much meetings they are conducting, how was the meetings participation of the WHNC members, is this for namesake, and we will visit the WHNC members for evaluating all this. And another important thing is disaster management plan of the LSG, local self-governments. Then external resource mobilization for innovative and initiative projects, that is different people's organization, institutions are supporting them for getting the CSR and other things for them. These are the major, whatever I have mentioned, these are the things just going through this. So our infrastructure and facilities. And just going through the major roadmap for Aardhrakeralam Puraskaram. As I mentioned, in every year when the ROP approval came, we will send the government a letter for constituting the judgment committee for the current last year's Aardhrakeralam Puraskaram. And when the GO is issued, mostly we are waiting for the GO for this year also. When the GO is issued, we will have the judgment committee, and we will fix the which year's evaluation period, and then we will start the training for the field inspection team. Before that, we will have the first phase of first phase of evaluation, that is selection of the priority list of top local self-governments based on the criteria we're using is that we have in Kerala, we have the state planning board have a software, Sulekha software. It was started in 2010 onwards. We will get all the local bodies who are getting their approval for plan period. They have to enter their projects with money, and after the projects are evaluating, they have to enter the expenditure for the money of the year end of the year in the Sulekha software. So our major partner for Aardhrakeralam Puraskaram for getting the priority list is that we will have a first meeting with the Institute of Information Kerala Mission, because Information Kerala Mission is running this Sulekha software for the government. And from there, we will first take the priority list. That is those local bodies who have achieved more than 50% of their allocated fund expenditure will be assessed for the will be screened for the first priority list. So after this priority list is established, we will have a meeting. Last two times we will have an online meeting for all those who have achieved 50% of 50% of expenditure. After that, we will the judgment committee, we will have a guideline preparation, and when we start the first judgment committee, we will present before the judgment committee for we will take 10% of this all from the prioritized institution. We will select 10% of district panchayat, block panchayat, gram panchayat for the assessment institution. So based on that, we will start the evaluation of this priority local bodies. In between, we will have a training at the state level for how this field inspection team are trained for collecting the data from the field. In that also, it's a one-day training happened for the districts, and a team from the districts, around 10 to 15 members team from each district with the different level of staff will come for the training, and the same team will going for the field inspection of the local bodies. In the second level, the thing is that we will send the data sheet, data collection format to the selected 10% local bodies for filling the formats, and they will submit the format to the state office. After this, we will start the, once the formats are sent back to us, we will start the field verification. This field verification is the first field verification is for Gram Panchayats only. In that, we have our strategy is a cross-district field verification we have planned. And one district will go to the another district, and another district, that is a cross-district verification we have scheduled, and it will take around 1 month for completing in 14 districts. In between, we will start our state level inspection for the district panchayat, block panchayat, municipalities and corporation. For this also, we will form a state level field inspection team with 4 team, that is for each local body, district panchayat, block panchayat, municipality and corporation. Each team will visit this local bodies for state level inspection. And after this state level inspection is completed, we will start for the mark coding process, and this mark coding will be done by a state level core team. When the first government order is issued at NHM level, we will form a core committee comprising of 10 to 15 members, and they are supporting us for doing this marking process and all our training, and supporting the district team for assessment and all. Once the mark coding is over, we will have the final judgment committee, and we will pass the marks to the IKM, and these 3 level marks they will score will be assessed based on the total mark. The judgment committee will declare the award for the local bodies which all are got the awards, and based on that we'll have the award ceremony function. Mostly it will not happen in the respective years, but it will continue in the because in last years happened in this April only. And in the during the field visits and the district and state award visits, we will because in all the team we have a documentation consultant in our district. So with the help of this documentation consultants, we will document the best practices in each local body, not in each local body, which all the best practices they have seen in their respective field visit, that will be documented. And that in every year, but not in every year, but this year we are going for a documentation of the best practices from the last year's achievement. These are the category of awards we are for district panchayat. State awards are for district panchayat, corporation, municipality, block panchayats and gram panchayat, and district awards for gram panchayat. The prize money is first prize for 10 lakh, second prize for 7 lakh, third prize for 5 lakh, and for district award it is first prize for 5, second 3 lakh, and third prize for 2 lakh. And once the award money is transferred and given to the institution, we have also given direction from our level how they can utilize this money. And this was also a government order given to local bodies, because when this monies came, they can utilize the money for the community welfare and all this. For this we have they can use the money for quality improvement activities for the Aardram Mission. Then as you know, lifestyle diseases are more in Kerala. They can use that for lifestyle disease control activities, setting up of gym or just like that. Then last 2 years we focused on COVID and COVID control and preventive drives. They can use that money for this also, and they can use for strengthening the new labs or existing labs. So this is the roadmap for Aardhrakeralam Puraskaram. We have completed 7 rounds of Puraskaram in Kerala, and we are going for the 8th round this year. We are waiting for the government geo. Last 7 years we have done this manually. This year we are going for a mobile app, because when the team is going to the field, they can 75% of the data they can fill in the mobile app itself. That process is also going on with IKM, and this year we'll planning our field inspection from July or August onwards. And these are the major words about the Aardhrakeralam Puraskaram we have initiated in Kerala, and this is government is considering this one of the best accolade to the local government, and a kind of activity which local bodies are accepting. This is in a very positive way, and we are very happy to share this with in front of you. And if anything more you want, can ask. Daman sir.
Yes, many thanks, Sheena. I think you have elaborately told about the whole process about the Aardhrakeralam Puraskaram. And now it is open for the questions. Anybody who would like to have more information regarding this can type their question in the chat box in the question and answer. However, there are few questions that I have received, and Sheena, it is for you.
Yes, sir.
Very first question is that the very first question is like, what has motivated the PRIs in this work?
What
has motivated these panchayats or the Panchayati Raj institutions, these people in this work?
What we are, it's once more, sir, it's not clear.
What has motivated the Panchayat peoples to participate in this?
The first motive is the award money itself. It's a kind of incentive they are getting. If they're getting first prize, the state level award, they are getting 10 lakh rupees. And they are getting this 10 lakh from the Honorable CM of Kerala. And it's a competitive award. And they can, in the award ceremony, we are showing in front of, because around 3,000 persons are coming for this award ceremony. And in front of them, we are showcasing what they have done in their field and what are the positive things they have done in their area for the community. And that itself shows, that itself is a motivating factor for the community, for the local bodies.
Yeah, nice. But they are also using the money of the award for the people's welfare only.
Yes.
It is not for their own personal use.
No, sir. It's they can use for their welfare of their own institutions, their own people only now.
Yes. So a lot of learning from Kerala for other states also. So the second question is like, you have talked about the automated system. So is it available in the public domain?
Automated system?
Yes.
Yes, sir. In most of our family health centers, we have automated system.
So the third question is like, how are the PRIs using this prize money? I mean, in the same kind of projects or something else? Something else.
I have mentioned that they can use for NCD activities, their improvement of their innovative. They can use this for some other innovative activities. In I don't know which exactly the name of the panchayats. They have utilized this for building a gym in their family health centers. They can start a yoga instructor for appointing 1 year for training their community people for learning yoga, and all these things they can do for from this money.
Yeah, great. So I have personally, visited this Nurpura PHC in Wayanad district of Kerala, and there are so many other innovations that I could able to see. There was one Pradiksha home, and in that Pradiksha home, the tribal women were being brought over there, and if any woman is anemic, so he is being treated over there. So that was one. The second was, there was a place for elderly in Wayanad PHC Nurpura, where they can come around, they can sit, they can chit chat, they can play some games also, and they can watch the TV also. That was also there. There are other innovations also that we can talk about. Do we have more questions?
Sir, in Kerala, around more than 100 not institution, health and wellness and family health centers, they are running Pagalvidu. It is the Pagalvidu is for, it's a daycare center for the geriatric people. They can, morning the Panchayat will, they have a vehicle. Most of this Panchayat's vehicle is sponsored from some other institution, some persons. So they will collect this old age people and they will come to the Pagalvidu, they'll spend their time, they'll have their breakfast, lunch, and after 3 o'clock, they will go back to their home. And it is just like a daycare crush for children. We are running that. So we have around more than 100 institutions, 100 FSs running this.
So, I mean, there was another question, and which is like, how is this helping the youth?
This Puraskaram.
Yeah.
Sir, all these activities are focusing not only for elderly person. All the youths are part of our health system now. They can in the all the sanitation activity, then this gym facility, all these are used for the youth also. So whatever the institutions are making, it's not only for specific people. The children are come, youth can come, women can come. There is no gender discrimination in the institution now. So youth also partially this part of this system. So one person is asked, any other states have this program? I think I just saw that in the chat box.
Yes.
I don't know. In Kerala, we are running from 2013 onwards.
We have got a very good institution in Kerala called KILA. So, I mean, what is the role of KILA, I mean, in building the capacities of our people who are going for assessment or for different kind of field things to see? So, can you elaborate on that?
Yes. So in 2012-13, when the comprehensive health plan activities were started, all our Puraskaram activities are related to CHP only. And during the first 3 rounds, we have done this under the guidance and supervision of KILA only. All the trainings for the medical officers, Panchayat members, and the field inspection team, that was done purely by KILA. But when KILA, when the responsibility of KILA is increased, we themselves started using them for specific activities like training component, and they are the judgment committee members. KILA director is also a member of our team. So now in all the districts we have units of KILA. State Institute of Rural Development converted to as a KILA. So when district teams are training, we are using the services of KILA for training and capacity building.
In other states, we are not able to see, I mean, an effective participation, I mean, so effective in health for the panchayats. So how do you elaborate, or how do you see the coordination between the National Health Mission and the PRI members in Kerala?
This coordination is started not from a single day. It's a year-long process. When 25 years back, when we started the People's Plan campaign, that time onwards, this health system and local self-governments are going together. Because the thing is, all the institutions are transferred institutions. So health system, the fund allocated by government is a very near thing now. So for the full-fledged functioning of an institution, they need fund, they need support from the organization. So all these funds, because when palliative care activities are moving, it's fully funded by palliative care, funded by local self-government only. Then when a local body is earmarking special funds for each health aspects, they are getting the benefit that the next year they can come, because when they are doing more for the public in healthcare activities, the public will returnly give benefit to the local bodies also. So that kind of reciprocal things are there itself. Then when the family health centers, when the Aardram Mission came, all these things, you can see when we are going to a family health center, you can see the photographs itself. Because in Kerala, most of the family health centers are like that only. When we are going to there, we will see that it's a private hospital. So that kind of competition happened in local bodies. Because when Honorable CM is inaugurating PSC to family health centers, all the local bodies are invited. So they also themselves says that when that local bodies upgraded this to in this level, why don't we? That kind of, because that kind of spirit we are giving them. And along with that, in every year, when the Panchayat election is over, health department themselves giving training to all local bodies, what all community activities are done by the department for that things, and how these local bodies can associate with the health department. This kind of, last year also we have conducted local body LSG members training under community process activities, and we have trained a module. We have developed a module and 1 day's full session with the PowerPoint presentation, what all things to be shared and all. So that all helped a very good momentum creating in between health department and local self-government.
Yeah, there is another question that we have received, like Kerala is taking a lead in climate-friendly healthcare systems. They are developing...
Which friendly, sir?
Climate-friendly. So in Nurpura PHC in Wayanad, I could able to see the material which was being used for the chairs or for the benches or for patients. Can you elaborate something on that? Climate-friendly healthcare systems.
Sir, we are using the local resources for the construction and the furniture and all we are creating. In Nulpura, we can see that most of the things are created from bamboo, because tribal people are more used with that. In Kerala, in Palakkad district, we have a unit there in Parapikulam PSC also. When we are entering there, we can see a lot of eco-friendly things are there in the. So that itself, because in climate change activities in the last 2 days before, we have a workshop here. And in Kerala, we are taking a lot of activities related to health and climate change.
Yeah, it is fine. We always look towards Kerala with new innovations. So there was another question, like, does the facility accredited under Aardhrakeralam Puraskaram also apply for Kayakalp?
No, sir. The thing is, when we are assessing Kayakalp Puraskaram, when we are assessing Aardhrakeralam Puraskaram, those institutions who have got Kayakalpa, cash accreditation, NQS accreditation, they will be getting a weightage. They will get a weightage mark in the score sheet. That is the thing we have added.
Another query, like the team of people who assess these all activities in the field, what is the team of people who all are involved into it? And you have told about the training, but a little bit more. How they are being trained? Are they from the health system only? And if they are from the health system, why they would not be biased, in assessing certain kind of facilities? So tell us a little more about it.
Our training, we have in every year we will train a 10 to 15 members team from the health department, including NHM, under the leadership of one deputy DMO from each district, and they will lead the team, and two other medical officers who are interested in assessment things, and we will include this NHM community process team, that is ASHA coordinators, quality manager, then documentation consultant, Then from the health services, we will have the mass media officer. We will have the two health supervisors, one DPH or MCH officer. This is a different type of persons are involved, included in the district team. The thing is, when they are going to a field, along with that, we will include 2 Ayush medical officers. And last year, we have included NREGA social audit team members in the team. Because when we are including the other persons like Ayush doctors and other team members, we can they can more go. Ayush doctors are there, they can visit the Ayush, because in most of the local bodies we have Ayush dispensaries like Homeo or Ayurveda dispensaries are there. So they can just, because most of them are coming from the district, different districts. So they can see how this how it is implemented, and the innovative projects they can apply in their field also, in their district and their hospitals also. So that kind of cross verification we have practiced till now. And regarding the training, when we are talking about training, first level we will, when I talk about now, we will send a detailed questionnaire to the selected, prioritized, screened local bodies. And based on these questions, we will have another questions for field verification. In the field verification questionnaire, they have to visit the institution, what all institution, they will visit the Panchayat, they will introduce the respective local bodies, and they will visit the innovative projects and health related projects. After that, they will visit the field for that's kind of social audit we are done through this, and that whole credit goes to Damana Huja sir. We will assess the community ward health team, and we will assess the social audit team will go to the palliative patients, AMC visit, bedridden patients, geriatric patients. We will meet the youth people, and we will go to the market. If there is any crematorium under them, we will visit them. So all this visit, it's a one-day full team. As a 10-member team is going, they will split into 3, and some person will visit the hospital, some will goes to the Ayurveda hospital, other team will goes to the public domain. So that level we will train them. And in the training, last session is to have a mock session, how they will interview a pregnant lady, how they will meet a palliative patient. That level we have scheduled our training.
Are you able to see one question in the chat box?
No, sir.
Do these award is repeated to some PRI?
Same PRI.
Same PRI, and are they bound to give expenditure detail against any development?
Definitely. Definitely they are. Very rarely reputation is happening, not all level, but reputation happening in corporation, state level awards will happen, because corporation we have only 6 corporation now. So I think in last 3 years it was there is a change for first and second, but this year a lot completely changed for their activities. So reputations are there for state level awards, but not continuously.
So there is a last question now I am putting to you. Does the survey question changes over the years?
Which survey question, sir?
I mean, the survey that we do for giving these awards, I mean, the field surveys that we do. So you see, I mean, so many new schemes are coming day by day.
Definitely.
So, I mean, we are just asking, there is a question like whether we are changing the questions every year. And if yes, then what are the kind of modifications that we do?
So based on the new programs, we will add our activities. Because when Aardram Mission came, we have our strategies for Aardram Mission. So that all things added. When the new programs like Jagrata Samdhis came, then gender-related activities were started. So that all will be included in the questionnaire. Then when COVID started, we have given a good focus on how was the COVID activities, how they managed COVID, and how many facilitation centers they were started for COVID prevention activities. So based on year's activities by the government, we will modify our formats. So when a first judgment committee is planned, we will before the judgment committee, the core team will have 2, 3, 4 round of discussions for preparing the modification of our guidelines for the previous years, and the same process is happening now.
Thanks a lot. I think for the audience information, the presentation that have been made by Sheena is also available in the chat box, so you can download it from there. And Sheena, now I thank you from my team, the AGCS Secretariat, to you and the whole NHM Kerala. And I also thank you for all the audience who have participated in this webinar. I hope you must have got some new information about Kerala. Thank you. Thanks a lot.
Thank you, sir. Thank you.
Good.